Hi, I'm Aaron Robles with Innovative Physical Therapy. I often get patients ask me questions and come see us about either nagging pain or injuries that won't go away, have chronic pain as well in certain areas of their body, especially with our athletes or right now who are trying to get better and perform better, and also with our patients that have a lot of activities that they have to do that are strenuous in their work duties as well and in their hobbies. So what we developed was what we call a functional assessment. In the functional assessment, we go through a systemic evaluation of how the body's supposed to move. So today I'm going to show you a couple examples of what we do with the functional assessments and show you how we get your body to move like it's supposed to, so that way you could really fulfill the full potential that your body can do. So you get the full benefit of all the training and the work that you do for it. Does that make sense? So today I have Reagan. It says volleyball player extreme here, extraordinaire, and she's going to go through a couple tests and we're going to see how she moves. So I'm going to start with Reagan and starting at her feet and her legs. What happens is if you have a dysfunction, mechanical dysfunction, when something's not moving correctly, it could affect everything all the way up. So if she's complaining of chronic knee pain or hamstring tightness, back pain or hip pain, it may be coming from her feet or ankles. So we always start here. So this is one of the things we do in an assessment, and we'll see what she has. So for example, I'm going to see how her ankle moves first. I'm just moving her ankle with my hands, and what I'm finding is she will rotate in her leg. Focus it there. If I do this leg, she doesn't. She does nothing there. So now, if you come closer and take a look here, as I just move her feet, I'm just moving her feet, I'm not touching her leg, you could see how her knee rotates in. You see that? And on this leg, just moving her toes, nothing happens. And this is what's supposed to happen. I'm supposed to just move her ankle, it shouldn't affect anything else. But you could see now as I do this, and you could appreciate every time she takes a step, her knee has to twist in because something's happening at her ankle, not allowing it to move fully. So she's compensating with her knee and her hip. With every step, she is torquing her knee over and over and over again. So she could come in with knee pain, and we could treat her knee pain or her hip pain, because that's where she's experiencing the pain. But if we don't treat this ankle first, it will not, it will not go away. It'll only be going away temporarily. So if you experience these kind of injuries, this is what, and this could be a reason why you're having it. And this is what we do. Here we have Reagan doing mini squats. Now we could see how she functions in weight bearing with that knee and with that ankle. And as you can see, her right knee bends inside her big toe, if you can see that right there. See here, she bends inside her big toe. But her left knee will bend and she stays over her feet. She does not go inside her feet on her left knee. But her right knee, because definitely you can see how it goes inside, because she has a movement dysfunction here at her ankle, not allowing her ankle to move forward all the way, so her knee has to twist in to compensate for that. So you can appreciate now in the sport of volleyball, for as much jumping she has to do, how much extra strain she's doing to her knee. So now we have Reagan sitting, because being a volleyball player, I'm concerned about her upper quarter, making sure her shoulder and her arm is moving and doing what it's supposed to do as well. She's not complaining about any shoulder or neck pain now, but we're going to test and see it, because we don't want her to just feel better, we want her to be better. And this way she could be the best that she can be at her sport of volleyball, if that's what she wants. Okay? Put your arm up near your left-handed, right? Yeah. So let's start with your left hand. Put it all the way up high, hold it there, okay? Now I want you to look at your hand, keep your hand right there. I'm gonna try to pull down. Don't let me pull down on it, just leave it there, okay? So this is a strength test, hold it there. And I'm not pulling very hard, am I? And she cannot do it. And this is her strong arm. Let's see what her right arm can do. Come on up again, hold it there. Don't let me pull down, keep it there, keep it right there. Again, I'm not gonna pull it very hard, pull it. And that's better, see that, that's stronger. And if feel that?
Yeah.
So she's weaker on this side, even though she's left-handed. So that means something's going on that she can't fully engage the muscle like she wants to. So being a volleyball player, especially a beach volleyball player, where the ball's a little harder, it could get, and it's not as predictable in playing, she could be really throwing her shoulder out because she has to work harder at working this shoulder because she has a full available strength. So what we have to do is find out what is it in her shoulder that is causing it so she gets full strength. Because one of the things she has knowing already is just the position of her shoulder. So I'm going to just see if I change the position, if that helps her at all. Okay, so let me have your shoulder. Let me have it here. Okay, so this is what's going on here. All right, very good. Keep that right there. Okay, ready? Right there. Very good. Is that okay there? Okay, so now raise your hand up in the air. That right there. Now look at your hand. I'm going to pull down again. Only pull you down, hold it there. And she's stronger. She's still working, but it's stronger. Feel the difference?
Yeah.
So is a position of her shoulder not allowing her to fully access her strength. So that was a good news. That was a quick fix for her. But the long-term fix is to improve that posture of where her shoulder is sitting on her rib cage. So you can imagine and you can appreciate now that she has some right knee issues and left shoulder, being a left-handed volleyball player on the beach, having to run, jump, and move really quickly from side to side. She could be really stressing her knee and her hip, her back, and now her shoulder, because if she's going to spike, she has to really drive off her right side to get her left side stronger. So she's now weak on her strong side, so she's not going to be able to hit the ball as well as she'd like to, and she'll feel like, I just need to get stronger, or she'll feel like I just need to hit harder, which could learn to lead to more issues with her pain and issues with her shoulder and her knee. So with a functional assessment, like we see here, we identify particular issues that she needs so that she can perform better, because she could try all she wants to hit the gym to get her shoulder stronger, but if she doesn't get moving correctly, then she'll just be injuring herself or just not being able to get any past any particular goals, or not feel like she's actually achieving what she needs to achieve. So these are a couple examples of what we would do in a functional assessment, because we want to get the full function of how the body is supposed to move and assess whether or not your body is doing it. So if you have these kind of dysfunctions that's mechanical with her, something's just blocking her, not allowing her to move well, then no matter how hard you try, it's just going to get worse. It's not going to get any better. So if these are examples of what you're going through, or for example, you're not performing like you think you should, considering the effort you put in it, then a functional assessment could be for you. And it could be not just for athletes, it could be for your work as well. If you feel like you have to sit too long, stand, carry, lift, push and pull, especially those repetitive kind of activities, you could be getting cumulative trauma, which is a little bit of issues and a little bit of problems. I have a lot of patients that come in and they do something that's very strenuous, like doing a deadlift or carrying a heavy box, and then they hurt themselves. So that incident didn't actually cause their pain, but what it did is it just revealed that they have a mechanical issue that they were just avoiding, and then when they got to a point where they could not avoid that activity is when they had caused their pain and caused their injury. So you could avoid all these things by just getting a functional assessment. So give us a call and we will get you in. We could do this, when you're ready.